Good afternoon, everybody. This is Carolyn Sawyer, along with a very dear friend of mine, Carla Winfrey, and we have come together. We've committed to come together on Saturdays to talk about the health wrap. And we thought a wrap would be appropriate because we've heard some of you all talk about the fact that you've been inundated with COVID-19 news. You're not watching the news anymore. You're just shutting off the TV. You're watching movies. So we said, how can we condense this and just give you kind of the headlines of what we think you really ought to pay attention to, and share some of the information that we've come up with so far as we've worked with doctors who are specialists in this field. But before I go too far into that, I want you to say hi to Carla, and I want Carla to say hi to you.
Good morning, Carolyn. I'm really excited about this. I was just thinking while we were coming on that we've known each other 30 years. And as journalists and having the backgrounds, it would be a travesty for us not to do something like this and to provide information to people who are underserved or in the African American community, because a lot of times those communities are overlooked. And also, we've been gifted with the gift of cutting and taking little bits of information or complex issues and breaking them down to information that everyone can understand. So I'm excited about that.
You're absolutely right. I was thinking this morning, we were friends before Facebook. Let's leave it at that. We won't get year specific, but Carla and I have been friends before Facebook. So happy to be working with you. As I look at the week, I look at a couple of big developments. For instance, I know you're in Tennessee. I'm in South Carolina. Our governor is saying that we are opening back up for business in just a few weeks. And as you know, last week when we started this endeavor, we had a group of doctors, 4 specialists who were actually on it. Those specialists were giving us their read on what would happen or what needed to happen in order to open back up. And I think you remember the one thing that Dr. Hildreth, who is at Meharry Medical College in Nashville, said is it needs to be an orchestrated, cohesive comeback. In other words, there's dangers in doing one state and not another state. And do you remember that conversation, Carla?
Oh, absolutely. And absolutely. And we're seeing now a lot of things that happened this past week related to, we can tell that some of the governors are going to go ahead and move forward with slowly integrating back into society. And you mentioned Dr. Hildreth, and one of the things that I wanted to bring up that I saw this week, this was in Essence Magazine, and he was part of the Congressional Black Caucus pushing for the equitable data collection and disclosure on COVID-19 Act. And so basically what this is going to do, it is going to be $50 million will be authorized through a bill to ensure that the CDC and other agencies, health agencies that collect data, that this data, there will be like an infrastructure that it would create an interagency commission to make sure that there are recommendations on the improvement to collect data and have transparency for actually places that have a lot of health disparities. And so Dr. Hildreth from Meharry was part of working with the Congressional Black Caucus on this. And so we do know that they also have a health brain trust that you're familiar with. So that's pretty exciting news that we will now have information in central location, and it's going to target these communities that we're so concerned about.
I mean, the bottom line is this, as fate would have it, I was scheduled to be in Washington, D.C. next week. I would have been facilitating what would have been the 13th annual conference for the elimination of health disparities. Dr. David Rivers with Medical University in South Carolina has worked with our Congressman James Clyburn out of South Carolina for years, over a decade, raising the attention on the fact that there are health disparities among African Americans, and that's why we're seeing these numbers the way that we're seeing these numbers. And what do we mean by that? Yes, there's the health stuff that you alluded to, everything from high blood pressure, heart disease, asthma, pre-existing conditions. But then also what Dr. Rivers always stresses upon everyone in the conversation during this conference is there are social determinants as well that make these numbers spike the way that they spike. And you could, an easy example is for those folks we've been seeing living in high dense areas. I mean, you and I are in southern states where we can kind of spread out, but in high dense areas, it's hard to do that 6 feet apart. And so that becomes a challenge for some folks, but it's the social determinants. Food, I mean, the doctors told us in the conversation last week, you want to eat healthy, you want to exercise, you want to get your rest. I mean, if you're living in a food desert, and you talked about this the other day, you're talking lately, that's like talking to the wall.
Absolutely. And one of the concerns when we have incidents like this, and how children are out of school, children in underserved communities, and especially African American children and Hispanic children, a lot of them get their daily nutrition from schools. So I know a school that I'm associated with, they provide 20 meals a week for each child. So what happens if you're in a food desert? What if you don't have fresh vegetables? One of the things Dr. Hildreth said when we were talking with him doing the PSAs was, let's look at frozen vegetables, let's look at canned vegetables, but we're going to have to, there has to be a new normal where we are really examining how people are living every day as far as their health. And that's multi-generational, from children all the way to elderly people. One of the things I was going to say, Carolyn, you mentioned as we return in the reentry, one thing I also saw yesterday in the New York Times last night, the CEO of Walmart had announced that all employees will have to wear a mask or some type of covering. And that's if you're in the front, back, corporate. And, remember one of our doctors, Dr. Donna Christensen, talked about, everybody needs to be covered because we don't know who has it and who doesn't. We need to, she said, act as though everybody has it. And that's one of the things she brought out in our 60-minute broadcast as well.
That's a good point. And so you talked about the business piece, and we actually want to show you a photograph from just this week. This is the Spectrum office, cable office in Columbia, South Carolina. What do you notice about this photograph? People are not going inside. Spectrum has decided they're not taking their customers inside. They have aligned tape on the wall of the building, so you know where to stay. It's a 6 feet distance between those pieces of tape. And then the rep comes out to get whatever material or whatever your customer service concern is. This is, of course, you're in the parking lot and you got cars backing up. So it's an interesting way of doing business, but we're going to see a lot of things like this. A lot of stores are doing this, marking X's on the floor and telling you where to go and what to do. What I think you and I have been concerned about, as we have had to venture out to get groceries for our parents, our elderly parents, what we've seen is a lot of people out here still not wearing face masks. And I don't get it. I mean, we heard the doctors say, the very first public service announcement that we put out there with Dr. Hildreth, you remember what he said?
80%. 80%. He also talked about how just talking, some people think it's, oh, well, you're sneezing on me or coughing on me. If you are talking, there are droplets that are coming out, and you can also contract it that way.
So if 80%, and the other thing he said that was so chilling is that we don't know who has the virus. And that goes to the whole testing piece. And that conversation continues. But I keep telling people, I don't know about you. We're still trying to figure out where these tests are. We keep hearing reports that there are enough tests, there will be more tests. But the reality is, and I'm, I will honestly admit to being a little leery on the testing, because my reality or my common sense says I can be tested tomorrow, and then next week I can be talking to you face to face, and who knows? I'm now in a situation where I've got I now have it and I have to manage it. So again, not saying you have it, but that reality is you can be tested and tomorrow still encounter somebody who does have the virus.
Yeah, and speaking of testing, I know you said some people don't know where to be tested. Well, another story that was in the New York Times this morning was about that Walgreens and CVS, they are going to have the drive-through testing. They added more states. So that made news yesterday and last night. And also you have places, for instance, like Meharry, they have testing stations. So just try to search and look in your paper, television, on websites, and see who has testing stations. I know some cities are now going to offer in states free testing as well. But you do want to make sure that the testing that is done by either a location that deals with health or deals with pharmacy, because they have companies that are coming in to do it. You want to make sure that you do that. And that's one of the things that the doctors also encourage as well. And as Dr. Hildreth and all the other doctors as well, they kept saying testing, testing, testing. I know sometimes people will say, oh, I don't know about this because of some other historic things have happened, but they keep saying we've got to get tested so they can figure out what areas are still hot. First of all, if you're healthy, and what areas are still hot, so they can put more concentrated efforts in those areas in trying to control the coronavirus.
Absolutely. I want to welcome a couple of people that have joined us for this conversation. Mandy and Hillary, we welcome you to this conversation. And we'll certainly entertain questions the best we can based on the facts that we've gotten from physicians. We started this initiative, Docs on Call. And I need to just publicly thank you, Carla. Carla's one of those friends you want to have when you got to get in the foxhole, because you can call them and say, girl, we're going into the foxhole. I need you. And no matter where she is, no matter how wild the ideal might be, Carla's down. And she's like, okay, let's do it, Carolyn, let's do it. And bravely went out and interviewed Dr. Hildreth at Meharry Medical College as we prepared those 6 PSAs. And those PSAs, if you follow the hashtag here, Facts Over Fear, you can see all 6 of them. I know it's one physician, and you might be thinking, I saw that before, but he has 6 varied points of view, and we asked him to cover everything. We also invite you to go and check out the 1-hour presentation that we did. It was a conversation, and that conversation really, it included some people that I've been around certainly for the last decade, some physicians. One of them was Dr. Georges Benjamin. And you remember Dr. Benjamin was the one who was on Capitol Hill testifying and sounded the alarm back in early March. And what he said is, if you've got a pre-existing condition and with health disparities, the African-American community is likely to die from this. And I asked them last week, and I said, is what we're seeing, the outcomes we're seeing in certain communities, what you expected? And they said, absolutely. What they didn't expect is that we'd have these kind of shortages with supply and PPEs and the like. But they said, this is what they said it would look like, because you were dealing with a population that was not healthy. I know you were pointing out this morning, Carla, that there was a story out there that referenced the number of individuals who were in nursing facilities. Again,
yes. I wanted to. Yes, this is a story also that's in the Washington Post, New York Times. New York Times, in fact, the headline is it just makes you so sad. And their headline for this story says, "Their death pits. Virus claims at least 7,000 lives in U.S. nursing homes." So we know about 6 weeks ago when we first heard about the one that was in Seattle. And now the Times, their research is showing that 1/5 of the deaths from the virus in the United States are tied to nursing homes and long-term care facilities. And when you take also the employees and the residents, they said it's more than 36,000 employees and residents who have contracted it. So this is a point that I wanted to bring up, Carolyn. You know, we have a friend who is an advocate for the aged with her company, She Ages Well, Pat Bailey. And one of the things that she said that we need to communicate to people, and we'll be bringing her on to talk about aging as well and generations, how it's affecting that community. But she said to make sure if you do have elderly relatives or someone who is in a nursing facility or a long-term care facility, to make sure that their information is up to date. Not just one contact, but you need to have another contact so they can get in contact with you. And you need to make sure that they have this information in the event that they have to be transported somewhere or the event they pass away. Carolyn, and we were talking about, you know, in New York, it's 14 days that they're holding some people at morgues if they don't have any contact information. So just make sure that you have your information to the proper people at these facilities.
Absolutely. I don't know if everybody else is like me. When I go to the doctor and we have that tough discussion and they give you options, I always look at them and say, well, what would you do? What would you have your mother do? What would you do? And so last week, I thought it was interesting. Dr. Tuckson, Dr. Reed Tuckson, was sharing that he made sure that he was able to get some equipment to his mother, some type of, I guess, an iPad, so that he could have some communications. Because let's face it, this connection is important. Um, you're blessed if you're in a situation where you're hearing on a regular basis. If you've got some folks you haven't talked to in a while, check on them, y'all. This connection piece is important. We're actually going to get, I see a few other people have joined our conversation. I want to welcome Fred Sawyers. Fred's not related to me, he's related to Carla. Thank you, Fred, for watching. Please share with your friends. We're trying to get facts over fear out here so that people know what physicians are saying, what they're seeing. We're also planning, as we make this commitment, to come and have brief chats. We're not going to talk to you all day long. This is not CNN. Let's be clear. We have parents we have to see about, things we have to do. But we've made a commitment to also bring on other physicians that can talk with you. I had a great discussion yesterday with a Dr. Marcus Yarbrough. He is going to be joining us. I think his date is May 1st. He's going to come on. I'm very interested for everybody to hear his comments, because he's actually in Washington, D.C. He's at Howard Medical Center. He's working on the front line. He shared with me what I think were just some riveting comments that I think he can deliver, certainly. But we're wanting to know what the front line is looking like. And what I found as he was talking, I found myself saying, well, how else can we help? There are things that need to be done. If you're bored, and you shouldn't be bored, but if you're bored, trust me, there are things that can be done in your community to help people. I want to welcome Monique to this conversation as well. And we're open to questions. We'll answer them the best we can based on what we have received from doctors who are serving as our primary advisors, and the information that we're seeing, obviously, in major news outlets. We're monitoring all of that. I think once you're a news junkie, always, right, Carla?
Yes, absolutely. I just thought about something when you said there are things that you can do. When I was talking to Dr. Hildreth, we were talking about people getting meals, because you need to keep your nutrition up, especially if you're fighting this. And I was saying, well, a lot of people are ordering takeout or having people bring things over. And I wanted to know, is it healthy also when we are shopping? I like the collard greens, the turnip greens, and these leafy greens, and you're scanning them across that scanner. And he was talking about, make sure, just like you have to do your hand washing, that you need to wash your vegetables. You need to spray down different things that you bring into the household, and then throw bags away. So I was just thinking about that, because some people are picking up items for people and some people are ordering food. He also said, if you are ordering something, to either pay, if you can, with a debit or credit card, or you need to have the exact money ready to have out there for the person, and just ask the people to leave it there outside on the step or a box or somewhere. So you do not invite other outside possible elements into your home.
This is the Health Wrap. We're welcoming everybody who's watching us, and thank you for joining us. And we promise these won't be long wraps. These are going to be pretty quickly. In fact, we're at the third segment, as the producer would normally tell me in my ear. I haven't done this in about 20-something years. Like riding a bike, though, right? So this is the segment, Carla. We're not going to leave folks with just all doom and gloom, okay? We're committed to getting facts out, facts over fear. But we're also committed to sharing with you some good news where there is good news to be shared. I spoke last weekend. It was a tough week the week before, because I lost a number of people who were important to me. They passed away as a result of this virus. Well, this weekend, I can actually say good news out of Chicago. Taryn, who we affectionately call her TJ, Taryn Jackson, friend of our family, dear friend, my sister-in-law. We're just so thankful and grateful that she's home. She was in a Chicago hospital with her mother, and they both made it out of the hospital. And y'all have seen those statistics out of Chicago. You remember Taryn from Dallas?
Yes.
So Taryn's home. Shout out to the Jackson family. I know they're praising God, as they say. Thankful that she's back, and she's on the mend. So
very beautiful lady inside and out. And I know she's done a lot of work in health as well, too. So I have a bit of news that I was excited about that's good news. So this week, the beloved actress, Taraji P. Henson, has announced that she is going to pay for 5 sessions per person for mental health virtual therapy. Now, this is important because so many people right now are very anxious, and people who are that may have had some mental challenges, and people who have never had them are experiencing this as well. I mean, we're in isolation, a lot of people are, and it makes people anxious, and you hear all these things on the news. So she has decided that her foundation, and she has a foundation, a mental health foundation, and the name of it is the Boris Lawrence Henson Foundation, which she founded in 2018 because her father suffered from some mental challenges. He was a Vietnam vet, and so she founded this foundation. And she's also been very open about bouts that she's had with depression. So that is good that somebody has come to the forefront to do something, not just, oh, I'm a star, but I'm using my star power to help people who are having some mental challenges or just they need some therapy. But she said 5 sessions per person. So you would need to go to her website. In fact, you can go to her Twitter. She has information on there as well. So we think that's some good news.
Very good news. Bonita Walker says, hello, Carla. A little shout out to you there.
Oh, we got First Lady.
Yeah, that smile is a good way to end. Well, we ran through this, but again, we're not going to overdose you because that's what we know is happening. People are getting information overload. So we really want to just highlight a few things for you to pay attention to, y'all. Stay woke, as the kids say. This is a multi-generation effort to outreach and to provide information. And Carla, we've got some exciting partners that we keep picking up today. If you know organizations that could benefit from our existing public service announcements, we can get them to them in a package so they'll have them all at once. They can loop them around. We want to get this information these doctors have shared with us that we need to be mindful of as we try to not only stay inside, but when we go outside, do the right thing so that we stay healthy. Carla?
Absolutely. And as you did say, multi-generational. So we're going to be in the trenches with people everywhere, anywhere from hip hop people to our doctors, because we know that different demographics within our community, we need to provide the messaging, and it needs to be very straight and clear. So we're really excited about some partners that will be, you'll meet a variety of people in the next coming weeks. And thank you, Carolyn, for asking me to even participate in this. And we want to thank everybody at home for joining us. And I guess we'll see you next Saturday.
At noon, high noon. We'll see you then.
Don't forget to look at the broadcast in case you haven't seen it that we have. This is the end of the health wrap right now, but we have the PSAs and we have our broadcast with our 4 doctors.
Absolutely. We want you to watch the content, share it with people. We've got to get the word out, everyone. This is so very important. And we'll continue. Again, we're committed to continue the messaging and finding additional partners that can share the messages so that the information can go out, because we are committed to facts over fear. We thank you so much for being with us. We want to thank Hillary on the back end for the technical assistance and support. We asked all of you all again to stay safe and stay connected. Have a great Saturday, everybody.
Bye-bye.